Hi, my name is Frankie Chambers. I will be performing BSN Skill Set 246. This is a head to toe assessment. So I'm gonna gather all my equipment. I have a stethoscope. I'll be taking her blood pressure, her vital signs, and also I have a pin light to assess certain areas. Okay. And I have a cotton ball here, which I'll use for the olfactory to assess the olfactory nerve. And I have here an eye chart to assess ocular motor, okay? So, let's begin. I'm gonna perform hand hygiene. I'm gonna knock on the patient's door, enter, close the curtain for privacy, introduce myself. Hi, I'm Frankie Chambers. I'll be your nurse today. Can you please identify yourself, first and last name?
Leslie Hernandez.
Okay, so I'm gonna verify that. Check here. Great. And now I'm gonna ask the patient, hey Leslie Hernandez, do you know why you're here today?
I'm here to get a full physical exam.
Okay. And do you know what hospital you're in?
Nightingale Mission Hospital.
Okay, do you know what's today's date?
July 19th, 2025.
And current president?
Donald Trump.
Okay, and the year it is?
2025.
Okay, she answered all correctly, so she is cognitive oriented times 4. She answered all questions. So I'm gonna go ahead and explain to her a little bit more before I take her vital signs. So Leslie Hernandez, the doctor has ordered me to come in and give you your first head to toe assessment. Is that okay with you?
Yeah, that's good.
Okay, so I'm gonna go ahead and check her vital signs. So her vital signs are normal. Temperature is at 98.6. Pulse ox is 98% with room air. Blood pressure is 120/80. Pulse is at 68. And respiration is at 20. And so now I'm gonna move on. So I'm gonna go ahead and I'm gonna don gloves and I'm gonna assess her scalp. So what I'm looking for is any signs of abrasions, or any type of damage or alopecia, or an infestation of sort, like as in lice or scabies. So I'll go ahead, don gloves, and I'm gonna go ahead and assess. May I assess your scalp?
Yes.
Okay, with permission. So I'm gonna go ahead, check here. Check behind the ears, on the side. There's no indications of lice, infestation, or scrapes or alopecia. So that's clear. So I'm gonna go ahead and remove my gloves and perform hand hygiene. Now I'm gonna assess some more of the cranial nerves. I'm gonna start off with the ocular motor. So I'm gonna go ahead and do test for eyesight. I'm gonna go ahead and test for vision. So I'm gonna shine this light in your eyes, and I want to see if your pupils constrict. Okay, is that all right? Okay. Pupils constrict, which is 3 to 5 centimeters. I'm gonna go ahead and have you follow this pen light. So I'm gonna move it in one direction, just follow it in that direction. Okay. She was able to follow the pen light. So I'm gonna go ahead and check now her conjunctiva and the sclera to see if there's any type of jaundice. The sclera should be white, and the conjunctiva, it should be moist and pink, no indications of an infection, which is conjunctivitis. So I'm gonna go ahead and check that. So I'm gonna pull down here. Can you look up for me? The sclera is white, the conjunctiva is pink. I'm gonna check the other eyelid. Look up. Same, no indications of jaundice or conjunctivitis. So I'm gonna go ahead and now check for sinuses. So I'm gonna check the maxillary, and I'm also gonna check two maxillary and frontal sinuses. So I'm gonna palpate down, and I'm gonna see if she feels any tenderness. Okay. Any tenderness, any pain? Okay. Patient did not state that they're feeling any pain or somewhat. So now I'm gonna go ahead and assess her trigeminal nerve, and I'm gonna have her puff out her cheeks and do smile so I can see if there's any drooping indications. Go ahead and puff out your cheeks, Ms. Hernandez. Smile, frown, puff out your cheeks one more time. Okay, everything seems symmetrical and no indications of drooping. So now I'm gonna go ahead and assess her olfactory. So I'm gonna go ahead and assess the olfactory, and I'm gonna look into the nasal cavity, and I'm gonna have her blow in one nostril and another nostril to see if it's patent, the airway. Okay, Ms. Hernandez, I'm gonna go ahead and take my pen light, and I'm going to have you lean your head back a little bit, and I'm gonna look into the nasal cavity. I'm looking for any type of obstruction, any type of buildup that might be there, and there's none indicated. I'm looking for also if the nasal cavity is moistened and not dry, and there's no dryness there. So now I'm gonna have the patient cover one nostril and breathe out. Now breathe in the other one. Perfect. So she's able to, there's no obstructions. She's able to breathe perfectly. So everything is patent. So now I'm gonna go ahead and assess her auditory and look into the auditory canal. Okay. So Ms. Hernandez, I'm gonna go ahead and look at your earlobes just to make sure there's no obstruction. Okay. So I'm gonna have you lean this way, and I'm gonna pull this out and back. The ana seems clear, no obstruction. I'm gonna do the other ear. And back. Everything seems clear and no obstruction. I'm gonna go ahead and have Mrs. Hernandez cover one ear, and I'm gonna whisper something to you, and I need you to repeat it back.
Okay.
Okay, Mrs. Hernandez. 1, 2, 3.
1, 2, 3.
And do the other ear. And Jamie.
Shimmy.
She was able to repeat the words back to me. So now, vestibular cochlear nerve is intact. So I'm gonna go ahead and do the olfactory, and I'm gonna take my cotton ball, and I'm gonna pass this by her nose, and she's gonna tell me what she smells, okay?
Cinnamon pepper.
She identified the smell, so the olfactory nerve is intact. So I'm gonna go ahead and use my Snell chart, and I have a couple of questions for Ms. Hernandez. Ms. Hernandez, do you have any type of vision problems?
I do.
You do? Okay. Are you wearing any contacts?
Not right now, no.
Okay, so I'm gonna perform this Snell chart here that I have, and it's usually 20 feet apart. So what usually happens is Mrs. Hernandez will read a line here. I would tell her to cover one eye, and then I would have her read this line here, and she will identify it, and this will determine what type of vision that she has in either eye, and that will determine the outcome, okay? But for now, we're gonna skip that part, but I performed the Snell chart. And so now I'm moving on to the neck. So I'm gonna go ahead and palpate her carotid, feel for a pulse. Okay. Ms. Hernandez. Good. She has a palpitation and pulse. It will be pulse strength will be greater than 2. That is considered normal. So now I'm gonna go ahead and palpate and check for check the carotid area to see if there's any indication of thyroid issue, enlarged thyroid. So I'm gonna go ahead and palpate here. No indication of thyroid issue, no enlarged thyroid. So I'm gonna go ahead and also assess her accessory. That's 11. So I'm gonna go cranial nerve 11. So I'm gonna hold her traps here, and I'm gonna have you shrug up. Okay, accessory muscles are intact. Okay, so now I'm gonna go ahead and assess for breathing, okay, and cardiovascular. So what I'm going to do is put my stethoscope, and I'm gonna assess for cardiovascular. I'm gonna assess for her apical heart sounds. So I'm gonna go ahead. So I'm gonna go ahead. I'm gonna move your badge. Is that okay? Assessment for pulse found, no abnormal sounds over the cardiovascular for the apical. So now I'm gonna go ahead and do the lung sounds, assess for lung sounds. So what I want to hear is clear lung sounds, no indications of wheezing or no indications of stridors or fluids within the lungs. So Mrs. Hernandez, I'm going to have you lean forward. Okay. So I'm going to go ahead and assess for lung sounds. Breathe in and out. I'm going to go ahead and check the back side. dentitious sounds found. No indications of wheezing or any type of stridor or any indications of fluids in the lungs. Lung sounds are clear. So I'm going to go ahead and test her range of motion. Sorry that my batch fell down. So I'm going to go ahead and have you extend your arms out. And while she's doing that, I'm going to press down. Try to not let me press down, okay? Okay, she has great strength, and I can tell that she has great upper body strength because she's upright. I'm going to go ahead and assess the skin. Skin is not dry, and skin looks to be even to her ethnicity of her color of her skin. I'm going to check also the capillary refill. 3 seconds. Also checking the radial pulse. Two or greater. Oh, this one's a great one. Yeah, this is a very strong one. Also, this is a good one, and I would say this is 2 or greater, so it's a 3. So now I'm going to go ahead and I am going to have Mrs. Hernandez lay down, and I'm going to transition to check her GI system. Okay, this is Mrs. Hernandez. Lay down. I'm also going to grab my badge. And I'm going to perform hand hygiene. Okay. So now that Mrs. Hernandez, I'm going to adjust the camera. Now Mrs. Hernandez, I'm going to check the quadrants, the 4 quadrants, and I'm going to check for vowel sounds, okay? So I'm not going to palpate, but I'm going to inspect first. So I'm looking for any type of distension of the abdomen. That might indicate constipation if it's distended, or the patient has not had any urination. The bladder could be distended. So nothing is indicated. So now I'm gonna go ahead and auscultate. The reason why I did not palpate because it can cause false readings when I go ahead to auscultate the sounds. So I'm going to go ahead and start with the upper left. Vowel sounds are present, so that's a good sign. So also I want to ask a question to Mrs. Hernandez. When was the last time you had a bowel movement?
This morning.
Great. So that bowel movement has been indicated. So I'm going to go ahead and now move on to the lower end. So I'm going to adjust the camera. Okay, so now I'm going to go ahead and check for any type of edema. I'm going to check the range of motion. So let's go with range of motion. So I'm going to have you lift both your legs up. Okay, so I'm going to push down on your legs, and don't let me push down. So she has good leg strength here. Okay, so now I'm going to check the pedal pulse here. Bilaterally, strong pulse, greater than 2. I'm gonna also assess for edema. Okay, no edema indicated. Now I'm gonna have her straighten her legs, and I'm gonna check the ankle strength. Okay, so I'm gonna push against your ankles, and you're gonna push forward. Okay, I'm gonna do a Babinski test, where the toes are gonna curl in. That indicates there's sensation. So go ahead. There is some sensation there. So I'm gonna have the patient sit up. Okay. So everything is now been completed. So this is a chance where I can ask the patient if they had any questions or any type of concerns.
No.
Okay, so next I'm going to do is perform hand hygiene, and then I am going to document my findings, if any, okay? And that concludes this session.